tomorrow's.
All right, let's kick it off then. Great. Thank you so much for joining us today, Sandra. I appreciate it.
My pleasure.
So before we begin, for those that don't know, you're not just a provider, but you're also an Airway parent. So if you wouldn't mind just sharing just briefly a little bit about your Airway journey with your doctor and Dr. Mew.
Well, I don't think of myself as a provider anymore, unfortunately, because I don't have bandwidth to do everything that I'm doing. But yeah, the issue that I had started with mostly my son, who was as a baby, mouth open, and I mean, I look at videos and I can't imagine why I left him so long with the mouth open, but I just didn't know what I know now. He's 23 now, but he was starting to snore and he wasn't overweight and he had every symptom in the book, from ADHD to irritability to poor attention. And you know, he was just not sleeping well and not breathing well. So I started and I went through everything. And as an orthodontist, I really didn't have any tools. Fortunately, he didn't have a malocclusion. His teeth were not, I mean, his jaws were not, didn't look like there was a problem. Because if it had been a problem, I would have said, okay, I'll fix the problem. And my brain would have said, okay, that will take care of it. But because he didn't have a tooth problem, I said, okay, he doesn't have a tooth problem. I don't have anything to do.
What's happening? Yeah.
And so I started going around. I was, at the time, this is in the early 2000s, I was asked to write a book in Mexico of just orthodontic questions, like orthodontics for dummies. And so I was writing it. And I shared it with my colleague and friend, Barry Raphael. I don't know if you know him, in New Jersey. And he looked at it. I said, can you take a look and make sure I'm not missing anything? And he looked at it and says, Sandra, go check out John Mew. When you see what he's doing, you will write something completely different. And sure enough, I went, and it just turned my world around, because when I saw the first photo of a girl that really had bad jaws, and next she was a gorgeous model, and I said, I want to know, because it was a long-faced girl, very hard to improve. If she came to me in my office, I would have said, my best case scenario is not to make her face worse. There's no way I can improve it. I just don't want to make it worse. And the improvement was insane. It was just a photograph, and I bought his book, and I read it cover to cover. I was in Great America with my kids, not Great America, one of the ones where they go swimming. And I was sitting there reading my book. I couldn't put it down. John Mew's The Cause and Cure of Malocclusion. And I say, well, why isn't everybody knowing this? Why has this guy been working 40 years and nobody knows
And no one knows.
actually do this? And that rocked my world. And I started, doing every single thing to my son. He was my guinea pig, bless his heart. His firstborn, a pleaser, so he was willing to do everything. He invented the bow, because everything that I put on him, he felt this is not good enough. And I said, well, if you're so smart, you tell me. And he said, you have to go from here. And he pointed at his chest. If you don't anchor from my chest, how's my face going to come forward? If you anchor from my face, there's no way it can come forward. And he was a 9 or 10-year-old kid. And I say, why he gets it and none of us get it? How can you put the face forward by anchoring from the face, right? It doesn't make any sense. And it was like the king's invisible clothing, right? Where one kid says, what's going on with this profession? And, I was just blessed with 2 kids in the 2 extremes. So I was able to experiment with both of them. So now I know what happens with a kid that you focus early enough and you get him right and he cooperates and he does everything as he needs to do it. And a girl who fell under the radar because her nasal breathing was okay, but she still had bad posture. And she wouldn't cooperate, and she wanted nothing to do, did not want to be mommy's guinea pig. So she grew up, and at 15 years old, she had double jaw surgery. And she's fantastic. So I have the case of the surgery. I have the case of like the hard work for years and years and years.
Yeah, you've
And
lived through both.
yeah, my son wishes he would have gone my daughter's way, actually.
Really?
Yeah.
Just
Which
because how long it took, or
how long it takes and how much effort and the substandard result you get. Because at 3 years old, the upper part of our head is 80% formed.
right? Mm-hmm.
Can't really change it. I mean, you can improve it, yes. And there's Dr. Mew's, the son goes through mewing and all this stuff that can make it better. If you're okay, it can make you better, but it's not going to fix you. You got to think of surgery after, and I said 3 years old. So my focus now is the first 1,000 days of life.
Yes, yes. And that's a
You-
great book, by the way.
Yeah. If you go into the 1,000 days, you can get things 100% right. Wisdom teeth, airway, growth, neural development. You can get everything if you do those 10,000 days properly. But on one side, doctors are not giving the right guidance, and parents are insane too. They're afraid of their children. And you gotta, discipline has been part of humanity. Modern human has been in this planet for 300,000 years. 300,000.
A lot
Modern
of parenting.
history, modern history of man is a tiny portion of that. And
Mhm.
industrialized life is a tiny, tiny, tiny portion of
Right,
that.
right,
And we've been here 300,000 years fighting against gravity, fighting against a fallen tree, fighting against a vicious animal that can kill you and your children. We would send our kids out of the cave, say, 50% chance they would not come back. So they had to be vigilant. They had to be toned. They had to be strong. They had to know what they're doing from birth. And
right. But
now,
within 100 years, we kind of took all that and went,
and we took it away, and we are going to suffer for it. And parents don't get discipline. I give them a pacifier to parents, and they say, well, my baby doesn't want to take it. And I say, well, maybe your baby has a nose problem. And they come to the office, and in the office, I take my screen and I said, if you take it, the cartoon plays. And this is an 18-month-old. And they take it, and they get the bubble in, and they're breathing right. And I said, he can take it. Oh, we don't do screens. I said, well, you do screen just when he's
for
wearing the
this.
path properly for this.
Mhm.
Don't
Or
use
do
screen.
or do playtime or do something. You've got to figure it out. And I think that's the hard thing, as parents, and you've already said it, and it's funny because every podcast it comes up. We don't know what we don't know, right? Parents didn't know. I feel so bad for every one of you that went through medical school, dental school. You don't know. You spent all that time. You don't know. And so now here we are in this huge, just microcosm of destruction, for lack of a better word, since the Industrial Revolution. And we're having to pick up the pieces. Nobody knew. So here we are. And as parents, yeah, that's going to put a little more onus on us, but you have to do it now that you've heard about it and now that you know about it, you have to take the steps. You no longer can say, I don't know. I mean, that's your job. You just got to.
Problem is that the parents are overwhelmed. Doctors are
Oh,
overwhelmed.
sure. Everyone is. Yeah.
I was just telling my friend yesterday, um, we have to pay taxes. Humans have to pay taxes. Hunter-gatherers did not have to pay taxes.
hmm
How do we deal with a life where you have to pay taxes?
hmm
There's so much stuff, and the dateline, the date
And
is
everything's speeding up. Everything's
yes,
speeding up, right? And you're in your
a
house. You can't be
military.
alone. Your phone is there. There's stuff on the TV, social. It's like everything is different. It's constant.
So we need to simplify things and give people things that they can actually do, because life is overwhelming. And people talk about holistic, I hate holistic because it's more and more things to overwhelm people. And yes, the doctors are amazing, but they're not doing the right thing, because there's for-profit medicine. But there's also for-profit holistic stuff. It's all
Mhm.
for profit,
Right.
all of it. I did a consultation with the mom yesterday. She had 3 kids. She's already spent over $10,000 for each one of her kids. The youngest one is
Mm.
9. In the holistic side, and her 3 kids are a disaster. I mean, the amount of empathy that I have a parent that has spent so much money, that has yelled to the children, do your myofunctional exercises, do this, close your mouth, and the goodwill of the families and the time in the table.
They're trying. Yeah.
Do your mouth closed, do this, do that. It's just so draining for parents, for families, for children.
Hmm.
We just don't have a path. And that's
Right.
what I'm committed to. I'm committing to giving people a path that is respectful
Hmm.
and has a clear beginning, a clear end, a price tag, a timing, and an expected result.
And okay, so I want to talk about that a little bit. So first of all, I'm going to show this, and we'll put links to it in our in the show notes. And I already told you beforehand, but just full disclosure, I don't tend to geek out on you very often. But you're one of the guests that I am geeking out about because this was literally one of the first books I read when I got to calf. And man, it gave me all the feels. So first, as a mom of two, devastated because I'm over here going, yeah, I miss that. I miss that. I miss that. I had one that was a mouth breather when she slept. And I'm, looking at all the issues she has. Then I have another one who seemed fine when she slept, but we ended up going down the retractive, let's pull teeth and let's, and I'm throwing up flags at my ex-husband going, no, please don't do that to her. I have this book. Please read this. We're not going to do that. So I was able to catch some of hers early enough, and then of course I'm reading it going, oh my gosh, this is me. So phenomenal book, Jaws. Every parent, if you haven't read it, please read it. Every physician, dentist, if you haven't, please read it. The stats are frightening. I'm not even going to bring up the stats. So you write this book, you put it out there, and it really is, it's a change, right? It was a line in the sand. Here's where we are. Let's change. So now I'm looking at your website, and there's some tools, thanks to trial and error on your son, that are out there now that are available for parents. So let's just kind of shift and go over there if we could. I would like to start with the pacifier. And before every parent clicks us off and says, oh, no pacifier, don't click off yet. Please listen. It's a very different concept and a very different goal. So can we talk about that one a little bit?
Yeah, we have to understand where we're coming from to
Mhm.
be able to know where we're going. And I've dedicated, I mean, just came out 2018. So it's been 6 years, and I've dedicated myself to try to figure out, like John Muir says, cause and cure, right? If you don't know the
Mhm.
cause. And the cause is really in the nose. And it's not that the nose is sick, because we don't even have a nose doctor. We paired out traditionally the doctors with the ear and the throat, right?
Right.
ENT. So
Hmm.
the nose is being overwhelmed with a lot of stuff. Not necessarily allergies, not necessarily sickness, just new stuff. And the nose is in the center. Why do you put anything in the center if it's not super important, right? Our nose
Point.
is in the,
Right.
so we know our nose is the gatekeeper of health. So, and the first thing that comes, obviously our skin, but the first thing that comes in, and you probably appreciate that, having had some throat issues yourself, you want to make sure what goes into your body is the right stuff to go in. You want to coat it with the stuff like nitric oxide going through the nose. And anybody listening to us now can do the easy, test of taking a breath through your nose and then taking a breath through your mouth. It feels completely different.
It does.
Through your mouth, it's cold, it's rough, it's nasty. Through your nose, it's warmed up and it's gentle and it feels right. But
When I do it, I also don't hear the phlegm. And I realize I'm different, right? Because of my condition, but through the mouth, you hear it catching on the phlegm and the scar tissue on my trach, but you don't through the nose. It's
so the
quiet.
nose,
There's no blockage.
yeah, the nose first has to be optimal. The good news is that our ENT, Dr. Angel, who's amazing. He's in Mexico, out of San Luis Potosí. If anybody needs an ENT, he's my go-to guy. He says he's neurologist and pediatric ENT. So he says form follows function.
Mm-hmm.
If function is right, the shape will become right. But there's always a but, only during growth. Only when we're growing.
Okay.
When we're growing, it reverses. Function will follow form. If the form is not right, function will adapt to that new form. So if the first 1,000 days of life, we don't push the function to be perfect, then the shape will not become what it needs to become. So we got to focus those 1,000 days. And our new book is called Nose. And one of the things we quote over and over and over is childhood is short. It's short. It's obviously it's important, but it is finite. So it has a beginning and it has an end.
Mm-hmm.
Once it has an end, it's irreplicable. It never comes back.
Yeah.
So it's very short with a very clear end. And when it ends, you don't get a second chance. So it is a scary thing to say childhood is short, finite, and irreplicable.
Mm-hmm.
That's just the way we're made.
Yeah.
So what do we want to do with that information? We have neural pruning. What is neural pruning? You know what neural pruning is?
I do not. What is neuro?
So
I can't even say it.
Yeah, the term is self-explanatory, right? Neurons get pruned like your plants. So
Mm-hmm.
what happens during the neural prunings throughout life? We have several, but we have very critical ones in early childhood. And that means the neurons in our brain, we are born with billions and billions and billions, or trillions, I don't know. And I mean, there's a number, but I don't have it offhand. But those neurons are not yet connected. Like my brother said when his child was born, oh, they're born without software. There's hardware, but there's no software. And they get the software as they grow. So we have all these neurons that are doing nothing.
Mm-hmm.
And as we do things, they start connecting. And we have a period where the ones that didn't get connected, they get removed. And that is neural pruning. You can look it up. There's all kinds of literature. There's a very large one at 7 years old.
Okay.
I think it's the largest, although there's still a lot of research going on. There's another one in adolescence, but the one at 7 years old is very critical. This is why you can do a lot of things like learn a language without an accent, any language you want before 7 years old.
Okay.
After 7, you learn a language, you always struggle with the accent because you don't have the same neuron. But before 7, you have so many. And if you learn 3 or 4 languages, they connect. Like I can very easily learn languages because I grew up in a family with 4 grandparents with 4 different languages.
Yep. Yep.
My neurons got connected. So I can learn very quickly a language where some people that never learned language, it's like black magic to them. For me, it's second. So we want to create more neural patterns. And we have those 1,000 days where so many neurons, they go from very few being connected to, we can almost see the electricity in these babies when they are born because there's so much going on. So it's urgent that we recognize those 1,000 days and we do the right thing. And we teach parents first not to be afraid of the children because children rule. I see all these 18 months old in the process of weaning, and the parents don't know what to do with them because they are underslept. They are the bosses. I mean, parents even go to say, I have one of my oldest sisters, he calls her baby lady boss.
Her baby lady boss.
They rule the home. Why? Because we're not giving parents tools, not because parents are bad. They don't have the tools, but discipline can be loving, can be right, and it's necessary for these kids to grow right. So we have 1,000 days to do it. And once it's finished,
no pressure.
We are going to be patching up. It doesn't mean you're going to be messed up if you're listening to you and you have a 5-year-old. There's still a million things you can do. If you're an adult, there's things you can do. But to really, really be 100% right, you need to focus, and those 1,000 days have to be critical. I'm not like my husband used to call him the breastfeeding Nazi. I'm not a breastfeeding Nazi. I breastfed my daughter to 3, but many parents cannot breastfeed, and that's not the end of the world. Of course, it's ideal,
Mm-hmm.
but I didn't know that the breastfeeding on the breast was so critical. I bottle fed my kids with my breast milk because I knew the chemical composition of milk was very important.
Was important, right?
But what about the delivery? And the same thing with the chewing, and the same thing with the weaning. The weaning
Mm-hmm.
for me is the critical part. The 18-month-old pacifier. This is
Yep.
where the magic is. How how do you wean into solid foods is critical, because we reversed a lot of things, and our research is pretty clear that we go from liquid to get out of here to right now. What we do is we go from liquid milk and water sometimes to mashed food
Mm-hmm.
with a spoon, and then we go to solids, and that is reverse.
Yep.
Viscous food is very hard for the tongue, for the brain, for the muscles to negotiate and learn. Solid food is better because we chew it, we are able to use our muscles, our teeth are meant for chewing. So as the teeth come in, we got to go to solid foods.
Because it also helps the jaw, right? Helps it grow forward.
Exactly. And weaning is a critical time to go to solid foods. And if you look in my books, a forwardonic book, I have I don't know if you have any of these, but in our
That one?
forwardonic, no, this one, no,
Oh.
yeah, but here in this one book,
Mm-hmm.
I put a whole 2 pages on how the baby develops the swallow. And I thought it was very important because I personally did not understand it. So if I don't understand it, how am I gonna explain it? But I
Right.
knew for a fact that babies, when they're young, they can't really choke, because the ability to, or the reason we can choke, and that is in jaws, is because we develop speech. So when there is no speech, then we really can't choke, because our larynx, see this? I don't know if you can see it.
Mm-hmm. Yep.
Larynx is high. So when we swallow, the milk goes on the side, So there
Mm-hmm.
is no connection. If we look at an open baby mouth, the connection to the air is up here, and the one for food is down here. So there's no connection. So through your mouth, it can't really go into your trachea. It go because your larynx is high. It's
Mm-hmm.
about the level of the ear. So as we develop as babies, the larynx comes down. It's part of when we start speech. That's what Jared Damon called the great leap forward. We gave up, like primates don't choke, but they can't pronounce the same sounds that we do. So
That
we
we
gave
do.
up the ability not to choke in exchange for getting very sophisticated with our language and communicative skills. That's how we became humans. When you become an adult, when you grow and you go into your adult swallowing, then the larynx is much lower. So we are able to choke. And I
Got it.
made very easy to follow drawings of how an adult swallows. Because when we understand that, then we know there's a window of opportunity to teach our kids to chew. And we are lazy. We are wired to look for comfort so we can survive, right?
Mm-hmm.
When we were in the cave time, of course, there was not a lot of comfort. So, we had to be wired to find it, because there was little of it, from sugars, fruits that we would find in season. But as we made life a lot more comfortable, there's too much comfort. Just like,
Mm-hmm.
if you walk, your legs are not going to work for you. Same thing with your chewing. And the window of opportunity is when you start weaning a baby, going to the soul food. That book is great, because you want baby-led You want the baby to grab the celery and chew on it and understand that your
Right.
baby is not going to choke. The baby's going to negotiate what goes down the throat and possibly cough. I have some good videos of babies doing that. As a vigilant parent that knows CPR, I always say you gotta do that CPR and you gotta be vigilant. You can't just throw it to a child and go do something else, right? You
Right.
gotta be vigilant, give them stuff they can grab, watch them, and they start negotiating with their tongue, with their muscles, with their neurons that are connecting. So there's so much we can do on those 1,000 days. We just have to be dedicated to those 1,000 days, and then we don't have to be so vigilant. But that short, finite, and irreplicable childhood has to be a priority. And I'm committed to letting the world know, because we know, but we need tools. And this baby-led weaning is great because the book is a tool, and you know what to do, and you know what to look for, and you can do it. And when your community does it, then it becomes easier. When you're the only one doing it, it's a nightmare.
It is a nightmare, right?
Why I created the pacifiers, because the pacifiers can help you in those stages and getting the nose to work right. Because the nose that doesn't work right will not take the pacifier, baby. And we published our first article on that with Dr. Calvo and ENT in Spain. And we measured the children that could not hold the device for more than 2 minutes were positive for, in the study, it was rhinitis. So they had an
Oh,
issue with
wow.
it. So if a baby cannot hold that suction for 2 minutes, then you know there's something in the nose, and you can take him to the ENT, to the pediatrician, because poor pediatricians, they're overwhelmed too. They
Sure.
weigh the baby, they measure it, the nurse does that, they come in, they're thriving or they're not thriving, they have a fever or not, next patient. How are they
Right.
going to look at stuff like, is the nose really working well? I mean, if the patient hasn't died, the nose is working, goodbye.
Right. Right. They're just trying to survive. So
Yeah,
if you
so
have a,
I
if,
agree.
for a
Yeah.
parent that's older, not a parent that's older, for a parent that has an older child, let's say 5 and up, where do they turn for help? What advice do you have for them if they're looking at this child going, mouth breather, or
Mhm.
ADHD or bedwetter or whatever the signs are, they're seeing it.
Mhm. Well, bedwetting is tremendous because it is so related to mouth breathing. It's just
Yeah.
crazy, the relationship when you start looking at the physiology of the aldosterone system and the suprarenal, hormone stuff, and how mouth breathing changes the levels of oxygen and carbon dioxide. So the lining of the bladder just gets released
Right.
because of that stuff. And it's completely physiological. It has nothing, or usually has nothing to do with the psychological part. So knowing that mouth breathing is related to bedwetting it has been a great thing to know, and we can do some things
It's mind
about
blowing.
it.
And for parents that haven't heard that, I'll put the link to Dr. Ben Moralia's explanation on that because that kind of blew my mind. I was not expecting that connection.
Yeah. When you look at the physiology, it's so clear.
Yeah.
So for older kids, um, it just becomes harder and harder.
Sure.
And the older they are, the hardest, and the more at risk the parents are to fall into somebody that can talk about something, but can't necessarily deliver. And it's really sad because we are all talking here about Airway,
Mhm.
but who can really deliver protocols that are clear, that had a clear beginning, a clear ending in time, in money, because patients are, they're spending a lot of money trying to find out what to do. And these protocols have to be available, and any provider, therapist or doctor or dentist or anybody that propose something has to be prepared to sit down for a discussion on, okay, who looked like my child? How were they looking when they came to see you? How do they look today? And how long did it take? Maybe not the money component, it's hard to ask how much they paid because every patient is different. But at least to have an idea, is this going to take a year? It's going to take 10 years? what's my child going to look like? And are they still going to need orthodontics, and why?
Mhm.
And, the cost can just run up. And I have
Sure.
families that have treated children for thousands of dollars, and all I can tell them in their late teens is, your child needs surgery. After everything you spend, after all the nagging, after all the relationships in your family were compromised, and even marriages fall apart through this, and the relationship with your own children and the
Stressful.
parents, the
Sure.
parents have
Yeah.
so much stress. And then I tell you, your kid has not improved. Had you done nothing, they would have been better. And think of surgery, which is $100,000 if you do it right. And where are you going to get this money from?
Mhm.
And is your kid really going to be open to doing this after everything you've told them since they were little? So it's a lose-lose situation. And I do so many consultations that are there that my heart just sinks
Mhm.
for parents that have gone through this loop of going to the traditional and saying, no, I'm going to do better for my child than just going this traditional way. And they
Mhm.
try so hard, and they spend, and they read, and they educate themselves. And at the end, they're worse off than had they not done anything. I'm not saying doing anything is appropriate, but I'm saying they're worse off, and it's really sad. And I say it with the empathy of somebody that did that, because I have in
Yeah.
my family, I have the two kids
Hmm.
where I did everything, and he cooperated, and he did, and he worked, and then I have one that said, "No, mom, I'm not doing this," and she had surgery when she was 15. And my son that went through everything said, "Mom, I would have rather gone the route
Just them out.
of having a carefree childhood. And when I'm
Mhm.
15, go under the knife, in and out. Yes, you have a horrible month. Yes, my mom had to, uh, mortgage her house to pay for the surgery, but my sister's better off than me." And I have a lot of patients that I'm, guiding through
In
the
the same
surgery
boat.
process, because you need an advocate, because there's also bad
Yeah.
surgical results, and that can be incredibly scary. So
Yep.
I only have one surgeon that I work with, because I know that I will get my perfect result every time.
From that one. Yep. And we have a few that we refer to, and that people that have come on our show, it's the same thing. We know because it's such a big deal, right? Just finances and recovery and everything. So as a pioneer in jaw development and airway, what have you learned over the past decade? And what has delivered the best outcome for your patients?
So for me, the obviously I've been talking about the first 1,000 days, but once that's gone,
Hmm.
then you have to sit back and evaluate things and try to get the environment to be as ideal as possible. So
Okay.
you got to get the nose working right. I love the GoBex program. Obviously, it's stuff that I've brought into the world because
Mm.
I did it with my child, and it was amazing. And it's 7 minutes a day. And I think everybody has 7 minutes a day for 90 consecutive days. It's not for everyone, because you do need a lot of discipline, but you have a beginning, you have a very clear process, and you have an end. And if you get to that end, you get this result, and your brain is rewired, and brain plasticity works. And GoBooks can be done by anyone, because adults can rewire their brain. Everybody can do GoBooks.
Oh, wow. Okay.
And we've created a program with Dr. Marcia Santos out of Buenos Aires, and it's all done in the mobile phone. You send her an email, and she follows the process and follows the 90 days with you through the app, so you don't have to go anywhere. It's very affordable because she's in Buenos Aires. Every patient that wants to do GoPix, I send to her, even though I can do it. My partner, who's a SLP, Catherine Colachico, she can do it. But for us, it would take more work than if they do it in the app with Dr.
Oh,
Santos.
okay.
Does it with kids that are 2 years old and with elderly that are in their 80s. So she
Oh,
can do it
wow.
in
It
the
really
80s.
is everybody. Okay.
Because it's a very, it's just based on posture, oral posture. And you set up the chair right, and you set up your hip right, and your feet right, and your knees right. And then you teach the patient to hold good posture. And then you do 7 minutes perfect, and we work on the pause. So the nose is part of it. We have to pause, make sure the nose is working, slow things down. We do it for 90 days. Our brain is rewired. We might continue it or not, but it's already in our brain. So if we ever want to have good posture, we know how to get back to there. And it's based on the Esther Gokle program, postural program that I did when I was having, she has a book called, and somebody you can invite in your podcast. She has a book called 8 Steps to a Pain-Free Back. So I went through her program and I said, this is fantastic. So I used that knowledge to put together our program. So we work on body posture, on feet, on knees, on mouth, on nose, and it's only 7 minutes every day. But it has
Right.
to stay. So it's very clear because I see so many exercises given to people and do this and do that and where is it? And there's no clear path of like how long, how many, where is the result, what am I going to have at the end? So I'm a very show it to me first before I do it. And when somebody cannot show me 10 people that have done what I'm being asked to do, and I can see where they went from where to when, I won't do it because I feel, okay, where am I going? And most people, that talk about Airway, they say, well, you have to do these exercises and every day and as many as you can. And then you come in and they give you another exercise and they say, muscle this and work this and chew this. And it's not clear. GoPix is 2 things.
Right. Where are you going? Yeah.
It's reading for 5 minutes and chewing for 2. Chew on both
Easy.
sides. I mean, I really want people to be successful.
Yeah.
Because I did so many mistakes that when I found GoPix, he was like, thank you. And I first learned it from Dr. Wong. He used to call it my exercise program. And when I saw his patient, I said, this is what I need to do. And I created the GoPix program out of we together, created the protocols. It was 30 days first, but then the literature says you really need 90 days. Repetitive. And if you do it at the same time, it's better. So GoPix is a great thing that you can start doing with kids that are 2 years old.
And I'll put
And
the
then,
link for that in our show notes too, so
yeah.
people can check it out.
Yes, it sounds like I'm a, snake oil person with a website with all this stuff that you can buy. But I've collected stuff that have worked for me. And what didn't exist, when I read 2006, the article of Dr. Engelke, and he created the up blocker and he published it and he cured people from snoring. And I looked at what he did and I said, where's this device? And I just said, I need to go get it. And he had made it himself. So we created the device and we packaged it and we made it available because it wasn't. And I said, it works. How come the world didn't? This works. And it's not my device. It's not my technology. It's not my patent. The pacifiers are, but not the blocker. And I saw that it worked and it was published. And he's an ENT, maxillofacial surgeon, and phonoaudiologist, triple PhD, head of a hospital in Germany. I mean, he had all the credentials and he wasn't online telling people about this. He just published it in the Science. He has over 100 articles.
Did it with his patients. Yeah.
And I said to him, why didn't you tell the world? And he said, the world doesn't care. They don't care about fixing and curing. The world cares about managing symptoms because that's profitable. And I'm not against people making money. I want to make money. I want everybody to make money. I teach our therapists to use the manometer, which is an incredible moneymaker. If you have myofunctional therapist, or you have phonoaudiologist or speech and language pathologist, speech pathologist, I can teach them how to make tons of money with our manometer because a manometer gives you a number. And when you have a number, you have accountability and you can practice meaningfully. And then you will come to your appointments and we have, protocols with 4 appointments. So you know where you're starting, where the middle is.
I was going to say you have a path. Yeah.
And when you have a manometer, you have a path. And when you know what's going on in the mouth, you can tell someone, no, your tongue is not a plaster to the roof of the mouth. Yes, it is. No, it's not. Look at the number here. If it was, the number would be negative. It wouldn't be positive. If it's positive, it means there's room, air inside your mouth. If there's air, your tongue's not plastered to the roof of the mouth. And you cannot argue with the number. But
Yeah.
you cannot be the patient that swears, I swear, I read about putting my tongue in there. And then when I go to, I say, what happens when you go to sleep? You
I snore.
relax.
Mm-hmm.
You relax. Even if your mouth is closed, your lips are visibly closed. If there's air inside your mouth, your tongue is falling down. And there's no amount of exercise, conscious exercise you can do to keep your tongue when you're relaxed. So the only thing that can help you is creating vacuum. Because when you create vacuum, and I can show you my little ventos that I use to show the vacuum. But when you create vacuum, things just stay.
Mm-hmm. It's a
So
vacuum. Yeah. By definition. Yeah.
the suction cup on the window is not pushing. But you
Right.
can't push it out. It's so incredibly strong, and it's not doing anything actively. Vacuum is passive. So our devices teach you to hold that vacuum. And now that we have the pacifiers, you can start teaching a newborn, because the newborns know when you're sucking on a pacifier, there's vacuum. If you
Mm-hmm.
can't suck on a pacifier, then your nose might not be working well.
And to be
So
clear, this is not a pacifier that you put in and you say, here's your binky, and you walk away and leave
no,
it for hours. This is an active tool that we're going to use for a session a day. Take it away, and then you give
the
it to them again tomorrow.
0 to 6, and this is all explained on our website. There's some videos there. The 0 to 6 is a screening tool. You use this to see if your baby is able to keep the pressure for about 2 minutes. If he does, he's fine. Then you give him a regular pacifier, which he also will have eventually, and they can have that all night. But this is a screening tool. If the bubble goes in, and now we have one that has a light, and we're working on one that goes to your cell phone, and one that it plugs into your cartoon so that the child can do that. So the early one is a screening tool. Then you have the transition one, and this one is the one they use to transition. Still has the nipple, but it
Mhm.
also has the shield. And then we go to the next one that only has a shield, which is basically the same as the up blocker of the adult treatment. So at 18 months, you take the nipple out, because when there's teeth, you don't need to have a nipple. Pacifiers have been there for, yeah, cave times, there's evidence we had pacifiers. It's a
Sure.
good,
Yeah.
as long as when the teeth come in, you don't need a nipple anymore. So you transition to just have the shield that allows you to maintain that suction at rest. And the one at 18 months, they can wear as much as they want. I do recommend it's not used unsupervised because it has a part that, they can pull apart. It's not bigger than the size that they can choke on, but you don't really want little
But
parts.
still, yeah.
Still, so you
But
want
again,
them,
it's a tool. It's training them to create that vacuum.
yeah. And just like Gopex, if they wear that device for an hour a day when they're watching TV and they're keeping suction during that time, or listening to a audiobook. We used to do the family treehouse. I mean the magic treehouse
Magic
and
Treehouse. Oh, yes, I know.
audio. My kids loved it. So when
Yep.
okay, let's listen to half an hour of this, but the bubble has to be in. And you're
Mhm.
very strict in not letting them use it without the right protocol. And if they do that an hour a day, it becomes second nature. You'll never have to worry about it. And the tongue will be up there expanding the roof of the mouth. So all the teeth can fit, including the wisdom teeth that gives room. So your airway is large and you never have to deal with snoring or sleep apnea or all the side effects that come from your breathing not being right.
Which would be amazing. So
So
at the end of
started
every
the
pod,
orthodontic at 18 months.
yep. And I've got links for all of this. We'll put all that in the show notes, as well as the books that we've talked about. So at the end of every episode, I always turn it back to you, the guest, because y'all are the experts, for a final thought to leave with our parent audience.
Well, final thoughts are difficult because parents are in a transition right now, but they have to support each other, get together, do groups where you're doing the right thing, talk about your successes, talk about your failures. Some providers are great. They're super nice people, but they're not doing the right thing, even though they might be telling you the right thing. They might not have the results. And be brave. because
Mhm.
saying this doctor, he's a nice person, I love him, he cleans our kids' teeth, he's fantastic. But the airway part didn't work for us, and telling your community and finding the ones and supporting the ones that do. The other thing, which is super critical, is don't drive yourself nuts over this.
Oh, yeah.
There's a lot of stress because you didn't do the right thing and you feel like a bad parent. Don't go that route. You're a good parent and things are changing. We're in a time of transition. Shows like yours are fantastic because they really go in depth. And there is a lot of good information out there, but you have to figure out which is good and which is not. And you have the common sense to find it. And I mean, I'm committed with my books to give out information so people can take this under their arm. Our upcoming book knows is doing that. It has a lot of solutions. And GoPix is a great solution that you can do on your own, or pacifiers, or op blockers. There are things you can do. Mewing can help if you have certain issues, getting the muscles, but going back to nature and thinking how we used to live on those 300,000 years where we're living in Cape Town. I'm not saying we should go back there.
Right,
We have,
right.
but you should take what was good then and
And
complement it
bring
so
it
that
forward.
the best of the past and we go to a much better future.
I think that would be perfect, right? That would be ideal. Well, thank you so much for coming on today and for everything that you shared and for being a pioneer and really just forging a path and putting this out there for all of us. Thank you so much.
I'm super committed, so I'm happy to come back whenever you invite me.
Thank you.